So there's a lot of preconceived ideas around hypnosis. In particular, a lot of preconceived ideas and concerns around this element of control. And in particular, people want to know, is their therapist able to control their mind or their body or both? And that's simply not the case. So anything that is within us is always under our control. So I'm talking about our thoughts, our actions, our behaviors, our feelings are all within our control. We always have the choice on that. So no hypnotherapist, no person at all is able to ever control what goes on within us. What you see on TV where people are clucking like chickens or going to sleep, that's not hypnosis. It's something entirely different, and that's for a different video as well. But the way I like to describe hypnotherapy is a little bit like meditation with a purpose. So it's a similar state to meditation, where meditation seeks to calm our minds. It's very gentle, very quiet, very relaxed, and its purpose is to create a quiet space in our minds. Hypnotherapy then takes that a step further, and once we have that quiet space in our minds, the hypnotherapist will then use that to offer suggestion. And this is typically around behavioral change or mindset change. And so just a very calm, relaxed state we call a trance state, where we can then ask and offer that suggestion around those changes of behavior and give our clients more positive processes. So why do we do that in a hypnotic state? Why not just give you those suggestions in the first place? And that's because there's always so much going on in our minds. It's very hard for us to process, can be very hard for us to process what our therapist is saying, because we have around 11 million bits of information coming at us at any one point, and we can only really take in around about 7 bits at any point. So what that means is that our mind has to make an unconscious decision what to listen to and what not to listen to. And typically what we do is we revert back to old patterns. So old patterns of behavior, old patterns of thinking, and old patterns of emotions as well that we tied to whatever stimulus we've just received. So because we revert back to old patterns of behavior, it makes it incredibly difficult to make those changes. So hypnosis, as I said, a very calm, gentle, relaxed state, shuts off all of those 11 million bits of information and just allows us to focus on the 1 or 2 bits of information coming at us, and makes us more readily able to understand them, and not just understand them from an intellectual point of view, but actually be able to put them into practice, and helps us to be able to change those long ingrained patterns of behavior that we might have been having for often decades. So as I said, it just allows us to be more available in order to take on that suggestion. So as a therapist, what I typically do is I look for those patterns, what sorts of patterns of behavior you're running, what sorts of patterns of thinking that you're running, and I look at what are the alternatives, and I'll offer alternatives that are better, that can help you see things more clearly and enable you to make those changes that you need to change. And even though hypnotherapy is a very gentle style of therapy, what we often find is that we can get really quick results. So people that have been running patterns of behavior or patterns of thinking can quite often make changes within 1 or 2 sessions. Sometimes when we're working with anxiety patients or patients with post-traumatic stress or depression or long ingrained mindset patterns, it can take a little bit longer, sometimes 4 to 8 sessions, and in some instances slightly longer. But typically when we're working with people, you'll start to see results immediately. So I've worked with smoking clients who have been smoking since before they were teenagers, who have been able to quit in just a couple of sessions, and other patterns of behavior and habits. People have been able to quit those within a session. And again, some of the more long ingrained mindset behaviors, even just as simple as 3 or 4 sessions, we've been able to really eliminate some of the people's big anxieties that some of my clients have had as well. So hypnotherapy is really great for anything that is a long ingrained habit, such as a mindset habit or a behavioral habit as well. So, as I said, people can be running these for decades and still get results in 1 or 2 sessions, whereas in talk therapy, they might have to go and talk about the past or the behaviors over and over and over again for months, even years. And typically, again, as I said, hypnosis is a very gentle style of therapy. At some points, you don't even need to go and delve into the past. So I often tell my clients that talking about the past is a little bit like having a cut on your arm that you keep picking at, and it just keeps bleeding and bleeding and bleeding. So that sort of therapy is not useful for everyone, because if we then pick up on that and we're constantly picking up on that, we're constantly in that space. So hypnotherapy allows us to move beyond that space and just focus on what are some of the better patterns, what are some better alternatives, what are some of those patterns that have been holding us back, and how do we eliminate them.